Hi everyone, you may have seen my content talking about EMDR, so you may be considering either EMDR therapy or wanting to learn more about it. And if you are, I thought it would be helpful to share this video where I talk about what EMDR is and what an EMDR therapy session actually looks like. So EMDR stands for eye movement desensitization and reprocessing. I know it's quite a mouthful. It's a therapeutic, evidence-based approach that has been shown to be highly effective in addressing trauma, anxiety, depression, grief and loss, creative blocks, negative core beliefs, and phobias, and a wide range of other concerns. So it's not just something that's used for PTSD and trauma, but all these other concerns that you may be experiencing. So being an EMDR therapist and having gone through my own EMDR therapy, I found it to be a really powerful tool in both helping me and my clients move forward in their healing journey. So while talk therapy is really helpful in allowing us to become more aware of our patterns, thoughts, emotions, EMDR really helps with moving things along. So I really enjoy using it in my therapy practice, and I found it to be really effective, especially when we get stuck in talk therapy and things are not moving along. That EMDR really helps with that. So in terms of what EMDR looks like, it is an 8-phase treatment model or protocol, and the first phase is very similar to any other type of therapy, where it's about gathering history, getting to know more about your concerns. And, with EMDR, we want to understand what your triggers are, what are the thoughts, feelings, body sensations that go with that, and what are some other memories and times in your life where you felt similar to these current day triggers that you have. So in phase 1, we help you really set goals and identify those target memories. Phase 2 is talking more about what EMDR is, getting to really help you feel safe and secure, both in the process and in the therapeutic relationship. And we spent quite a while talking about resources or coping skills. So those are the things that you already have in your life that help you, that we could tap into if you experience any emotional disturbance while you go through the process. And I or your therapist may share other resources with you that you can utilize, and those could be mindfulness skills, grounding skills, guided visualization, or any other practice that resonates for you. So that's going to be tailored to your unique needs and preferences. Phase 3 is when we identify a specific target memory that you want to work on that causes you distress. So I will be asking you to tell me what your distress is, what you believe about yourself surrounding that memory. What are you noticing in your body? What are you feeling? And what you'd like to believe about yourself. So once we go through that process, we move into phase 4. And phase 4 is where BLS, bilateral stimulation, happens. So bilateral stimulation could either be eye movement, it could be audio, it could be self-tapping, or buzzers if you're having in-person sessions. And if you're doing EMDR online, which is equally effective as doing it in person, your therapist may use a program to do the BLS, either the visual or audio or a combination of the two. And this is the part where your therapist asks you to hold the memory, the target memory, with the belief, with the emotions, while you do the BLS. And the BLS, or bilateral stimulation, taps into the natural healing abilities of the brain. The same way rapid eye movement or REM sleep helps us process and integrate experiences from our day, bilateral stimulation helps us move these distressing experiences from our limbic brain, our reptilian brain to our prefrontal cortex. So you go through this process. Your therapist will ask you between those BLS sets to pause, take a deep breath, notice what's coming up. And we just keep going through this process till things start to shift and your distress goes down. And once you get there, which, again, that depends on different factors, like, how distressing the memory is, how many traumas you've had. Once you get there, then we move into the installation phase, which is phase 5, where your therapist will have you remember the memory with and pair that with the positive belief that you've formed with that memory. And once you go through that, then we go through phase 6, which is the body scan, to make sure that your body is clear, that there's no residual distress left from the memory. And then we move into phase 7, which is closure. If we've gone through all those steps and you've completed it, we'll check in and ask how you're doing and make sure that you feel stable and safe before you leave that therapy session. And we talk about, resourcing. What are you going to do to take care of yourself, to ground yourself if you do feel distressed? And then phase 8 would be just to check in and see, check on those targets, check on those your distress to see if it's gone down, if those beliefs have shifted. And once you get there, then the future template would be the next step, which is a situation in the future that could be potentially triggering the same response where these new beliefs could serve you. So then we kind of go through those phase 3 to 7 once again with the future template. So these are all the steps involved. And, in terms of how long it takes, again, it depends on each client, their level of readiness, and, all these different factors. Typically with EMDR therapy, things move more quickly than talk therapy because it's structured and because you're focusing on, moving through those memories, both through the nervous system and your brain. So I hope this was helpful to you. And if you have any questions about EMDR, you can put it in the comments and I can answer those questions. Thank you. Bye.